Building on this examination, our next presentation takes us further into the world of mental health and therapy, exploring how Western psychotherapeutic frameworks often overlook or dismiss Dharmic perspectives on well-being, suffering, and healing. While yoga is increasingly integrated into psychological treatment plans, the deeper Hindu worldviews that gives these practices their meaning are often left out, limiting their potential to fully serve clients, especially those from Hindu and South Asian backgrounds. To help us explore how these gaps can be addressed, we are honored to welcome Dr. Kavita Pallod Sekhsaria ji. Dr. Sekhsaria is a clinical psychologist and the founder of KPS Psychotherapy, a practice dedicated to providing cultural attuned mental health services to the South Asian community. Her work is rooted in the belief that mental health care should honor the cultural and spiritual context of clients rather than force them into the one-size-fits-all model. Dr. Sekhsaria's doctoral dissertation, Hindu-Indian American Conceptions of Mental Health, unpacks how understanding a Hindu worldview of mental health can improve access to therapy for the underserved Hindu American population. Her work destigmatizes spiritual coping mechanisms, which are often marginalized in Western therapy, and advocates for restoring Dharmic frameworks to help clients navigate suffering in ways that resonate with their cultural and spiritual roots. In addition to her clinical work, Dr. Sekhsaria serves on the board of directors of the Hindu American Foundation, where she supports the organization's educational and advocacy efforts. Today, she will explore how restoring Dharma in psychotherapy not only benefits Hindu clients, but also broadens the fields of understanding of holistic healing. Please join me in welcoming Dr. Kavita Pallod Sekhsaria ji.
Thank you so much, Adyaji, for this wonderful introduction. I'm really excited today to join you guys and again taking a deeper dive into restoring Dharma into psychotherapy. So hopefully you guys can all see the presentation. I think I just need to move into actual presentation mode. No. I don't want that. I want my presenter mode. Sorry. I thought I was gonna do this so seamlessly for you guys. Okay, you know what? We can do this without the notes. That's great. So, a little bit about me, just to start. I am the eldest daughter of two immigrants, which I think has been profoundly shaping of my experience. Was raised in the Hindu community in Houston, Texas, which is very special and really formative in the worldview that I'm bringing to you guys. I did attend the University of Texas at Austin, got my PsyD at Rutgers, GZAP, and I guess perhaps most notably, I did my dissertation in Hindu-Indian American conceptions of mental health, but at the time that I did it, I had really wonderful coaches, but ones that were not experienced in this field. And so I think that I've learned so much from since then, and I hope that being able to engage in some of the content that we are today empowers you if you are interested in therapy and psychology in general, to really deepen the way that we can think about this topic. So yeah, I want to define all of these words as we dive into them. So, what is psychotherapy, right? We're really talking about forms of communication and interactions to assess, diagnose, and treat dysfunctional emotional reactions, ways of thinking, and behavior patterns. So, what is notable about this definition, right, which I think is a fair one of what is practiced today, is that while the word has its roots in the psyche, the spirit, the soul, and in healing, we're actually really missing that spirit of spirituality in this definition. And when we talk about really understanding psychotherapy and understanding the biases in this framework, we have to appreciate that in spite of the meaning of psyche, in the goal of being an objective science, we've really evolved a field that tries to cleave the mind from the spirit. Why is that, right? Because we're evolving in this weird, as the wonderful Dr. Shilpa Pandit puts in her book Decolonizing Consciousness, which I can't recommend highly enough because I'm not able to do justice into all of the biases in the psychotherapy framework in this short presentation today. But we know that this field has developed, has arisen in Western educated, industrialized, rich, developed nations. And so there's a bias inherently in being able to understand Indic psychology and how indigenous people around the world have actually like really understood what it means to pursue well-being and what works, right? And so when we look at modern psychotherapy, I think what we really have to acknowledge is that while in 2025 the idea of decolonizing is a big deal, and Jennifer Mullen's Decolonizing Therapy book is I believe has been on many bestseller lists, that there's deep challenges in the decolonizing movement, right? Because it is by practice and by intention deeply entangled with political activism. Engaging in this work is fraught, especially for Hindu Americans, where so much of the work that's being done in decolonizing is also coming from people that believe that, the only way to eradicate caste is by, dismantling Hinduism. We're talking about people who think that this framework of Hinduism itself is so problematic that they're pushing words like dismantling, right? And so the work that actually needs to be done for decolonizing is currently not really lifting up the Indic voices that need to be lifted up to really understand what it means to actually decolonize therapy. And the other problem with this, right, is that the actual benefits of therapy, I think that one of them is that it can be a non-political space. It can be one where you're really holding people with openness and with judgment is then brought into question, and you have so much dialogue and so much kind of just a disagreement happening in the field right now about how um, political it is to be how okay it is to be political in a field that I think has so much power in actually being able to move away from that. So, one just example that came into my inbox this week is this article at Psychology Today, one of the biggest, databases of providers in the world. And it's on the system justification theory with the caste system and the idea that psychologically people who um, are oppressed by systems still uphold it because of low self-esteem, etc., etc. And so while I think like there may be kernels of importance to this whole article and the idea that, um, moving forward and really getting justice will be not through legal means, as, Remy's wonderful presentation also really helped us understand. It'll be psychological. I think the whole framing of how we're talking about what is actually happening with people in this culture is deeply problematic. So, I think the other main frustration with the field, which gives us an opportunity to really then engage in where Dharma can really come in, is that in spite of increased access to mental health resources, unprecedented access, right? We're seeing rates of depression and anxiety disorders in particular increasing. And so, if we were thinking about, oh, the polio vaccine production has gone up, 5,000%, but polio cases are going up, we'd really ask ourselves, what is going on? Is the treatment itself flawed, right? And so I think that while obviously the treatment of mental disorders and polio are very, very different, we still need to be interrogating the field and to be interrogating treatment as it stands today. Because I think two of the biggest things that we really have to consider are that while we have increased access to mental health resources, increased self-consciousness is actually very, very highly correlated with negative affect, higher anxiety, a lot of things that lead to distress. So is the treatment inherently flawed in that way? And do we have to unpack what it means to actually be able to address that criticism of the field? And of course, we can't have a conversation about mental health without acknowledging the huge impact that social media in particular has, and smart devices generally, even without social media, have on it. But if that is, one of the biggest things that is impacting everyone's mental health, then what is the mental health field doing to advocate to make sure that we are putting the checks and balances on, whether it's social media companies or smart devices or whatever it is, to then make sure that everyone is getting the mental health resources that are actually effective, right? So I think these are important frustrations. Now, because I'm intrigued with or invested in defining all of these terms for you, will define Dharma too, right? And the Dharma traditions, which are traditions that arose in ancient India from groups that were so diverse in every single possible metric of diversity. But what are the common threads, right? It's that commitment to functioning pluralism in spite of all of their differences. But more relevant to us today is the idea of samsara, right? If we're talking about how inherently life has ups and downs and happiness and distress, and that the goal of life is to either change our circumstances or reorient our understanding of our experiences, then we can see that Hinduism and all Dharma traditions are really oriented towards gaining psychological wellness. And so it's not, like what piece of Hinduism is oriented towards this. All of it is, by definition, right? We could make that argument. So, I think that a lot of times, and this was part of my research in grad school, is that we don't recognize how many resources we have to talk about mental health in Dharma traditions. So, I really appreciate Snehaji talking about the Guru Shishya relationship, right? And again, we can really understand so much of this relationship as oriented towards building and equipping well-being, right? And maybe we have a little more familiarity with Ayurveda, but when we're talking about our physical diet and how we can change that to balance our gunas, there's so much to be said about changing our mental diet or emotional diet and being really intentional about how we're creating balance there for ourselves. That is acknowledged and encouraged, and resources are given for this in our shastras. So I won't get into tantra as much or itihasa, but our epics are so lovely also, as we see them as just written testimonies to how to engage in this work and how to work towards well-being while experiencing so many different situations. So we see so many techniques, right? And every single thing on this list has probably made its way to cognitive behavioral therapy in particular. We may see them in acceptance and commitment therapy and dialectical behavioral therapy, and I won't bore you by going over it, but the technique, the actual practices that we can engage in is really listed out comprehensively in the things that we can do. Now, knowing that all of these techniques came from Dharma traditions is so important to understand that these work when you understand the world through a Dharmic worldview, right? One that comes from that functioning pluralism, one that comes from this idea of samsara, because then you have the potential to use these techniques to connect to something bigger than yourself. And yeah, you can do alternate nostril breathing without thinking about the nature of the universe, and it will be helpful, but in not acknowledging that, like, this is really oriented not just to, quell your distress in the moment, but to quell your existential distress, something is lost for so many that we have to acknowledge. So, I think when I think of this question of like, what does restoring dharma to psychotherapy mean? We want to understand, like, what are we trying to treat, right? What is afflicting Hindu Americans? Mood disorders, anxiety disorders, of course. Those typical of the general population, not just of the US, but of the world at this point, right? And the factors are the same, but also so different, right? And the manifestation of mood disorders and anxiety disorders among Hindu Americans is the same, but is also different too, right? Whether we are talking about gender differences, or if we're talking about really how the lack of culturally competent care because of all of the biases in the framework that I mentioned before. So the four following questions I think are important to unpack, right? Which is, how can therapy hurt Hindu Americans? It can profoundly hurt people, because we've talked a little bit today about how self-consciousness, when it's increased, can increase distress. But also, we're in a moment where a lot of behavior is pathologized. It's actually very healthy in cultural contexts, whether we're talking about boundaries and, cutting off family members and family friends and societal support that can actually be really, really important to our growth, or a number of other ways to really pathologize culturally helpful behavior. And, we don't just see non-Hindu, non-South Asian therapists advocating for this. We see people within the community too failing to understand really the contexts in which these behaviors developed and why they're important. So therapy can hurt, but at its best, and I think a lot of people are practicing therapy at its best, to be clear, it has a potential to do something that's very in line with Dharma, right? Relieving our distress, equipping people to make meaningful connections, do meaningful work, and align who they are with who they want to be. And this is probably the hardest slide, because it doesn't have to be this way and it shouldn't be this way, but there are people who have difficult experiences with trying to engage in Dharma traditions for a myriad of reasons, but some of the most simple can be just feeling misunderstood in their daily concerns and told to meditate when they're not ready to, or even just like being overwhelmed by the number of approaches available to them. But what we know is the immense potential to really help individuals accept and grapple with samsara, to change their circumstances, reorient their understandings of life, to experience everything from a reduction of distress to liberation from the cycle itself. So, what is our opportunity here to create a more inclusive and also effective field, right? When we know what the limitations of psychotherapy in 2025 are, we know that Dharma traditions and the practices within them offer so many ways to really counter those, right? And so we can both appreciate that psychological science has ways to validate and offer new means of healing that are effective and important, while knowing that when we can understand the Dharmic worldview and share that the work can be enhanced not just for those who are Hindu, but for everyone who is attuned to their role in the universe. So yeah, that is where I will wrap up for today.
Dhanyavad, Dr. Sekhsaria ji, for that powerful and deeply insightful presentation. What we heard today highlights the critical need for culturally sensitive approaches in psychotherapy, ones that don't just borrow practices like yoga, but also respect and integrate these worldviews from which they emerge. As Dr. Sekhsaria shows us, Dharma offers profound insights into suffering, resilience, and healing, insights that are often overlooked in conventional Western therapeutic models. When Hindu clients enter therapy spaces where their spiritual and coping mechanisms are dismissed or misunderstood, it creates barriers to care. But when therapists approach mental health through dharmic frameworks, they open the door to truly holistic healing. This conversation is not just about Hindu clients. It's about broadening the field of psychotherapy to honor the diversity of human experience and wisdom traditions. Let's give another round of thanks to Dr. Kavita Pallod Sekhsaria ji for her invaluable work in restoring Dharma to the therapeutic space and advocating for a more compassionate and culturally aligned mental health care.